Welcome to our show, Health and Wellness, Myths and Facts. Hormones affect more than just our mood. There are hormones involved in almost all bodily functions, spanning from the basic, such as hunger, such as the complex ones, such as reproduction, emotion. Generally, men and women have almost but the same hormones, but their production sites, their blood concentrations, and their interactions with different organs and systems are different. Hormonal disorders are more common among women as compared to men. Also, there are certain women-specific hormonal disorders. Endocrine disorders and hormonal imbalances can pose serious health and well-being risks for women. As we live in today's modern world, we are increasingly exposed to environmental factors that compromise hormonal balance, such as extreme stress, exposure to harmful chemicals, and westernized diets. Women should know which factors can trigger hormonal imbalance and how to manage that situation. Most such conditions, when identified early and treated, help to correct the hormonal imbalance, reducing the symptoms and health risks associated with hormonal imbalance. Our experts today will provide medically accurate and actionable advice to help prevent the development of hormonal disorders, as well as guide our viewers with effective long-term management strategies. We have with us Dr. S. Sridhar, MD Medicine, Endocrinology, Assistant Professor Endocrinology, Department Madurai Medical College, Government Rajaji Hospital, Madurai. Welcome, Doctor. We also have Dr. Jayashree Swain with us. She's MD Medicine, DM Endocrinology, FIDM Professor, Department of Endocrinology and Metabolism, IMS and SUM Hospital, Bhubaneswar. Welcome, Dr. Jayashree Swain. And we have Dr. Neeti Agarwal, MBBS MD, Medicine, DNB Endocrinology, Senior Consultant Endocrinologist, Max Super Speciality Hospitals, Indus Health, Delhi. Welcome, Dr. Agarwal. My first question, of course, is to Dr. S. Sridhar today. Doctor, hormones affect the quality of life for both men and women, but for women in particular, how does hormone affect women's health?
Hormones affects women's health in multiple ways. One of the important thing that affects women's this menstrual disturbances. There is a menstrual irregularities. Regularly, women have the cycles once in 30 days, and some of the hormonal irregularity that lead to cycles once in 2 months or 3 months, or maybe once in 6 months also. So the cycle irregularity is one of the most important way that hormones affects women's health, and subsequently the reproductions, that is fertility issues. So whenever the women is having hormonal imbalance like hypothyroidism or any prolactin related disorders, that may lead to infertility or delay in the conceptions. That is another important issues. And after conceptions, some women, they may have developed the gestational diabetes mellitus. So it is due to the impairment of insulin actions or defect in the insulin secretions. So the both leading to gestational diabetes mellitus. And after delivery, women may have the lactational failure that may be lead to the prolactin related issues. And subsequently, after the menopause, women may have the bone related issues like osteoporosis. So the maintaining the bone health, the important hormones, estrogen is required for women. And at last, the general well-beings. So to maintain the normal day-to-day body's well-being, the two important hormones are thyroid as well as the cortisol. So these two important hormone deficiency, they may lead to poor quality of life or impairment in the general well-being. So in such a ways, the hormones have most important role in day-to-day life.
Thank you, Dr. Sridhar. My next question is to Dr. Jayashree Swain. There are very many women viewers watching us today, and one question that most women would want to ask is, what are the symptoms of hormonal imbalance in women? Please shed some light on that.
Hormones plays an essential role in this body, regulating the various metabolic functions like growth and development, reproduction and sexual health, bone and mental health, the blood sugar and blood pressure. The symptoms of the hormone imbalance can vary according to which endocrine gland is affected and at which age the woman is affected. And the symptom may be weight loss, weight gain, and that rough skin, thin skin, constipation, diarrhea, and there may be the depression, mood changes, anxiety, and mental ill health, menstrual irregularities, and infertility when thyroid gland is involved. And there may be obesity, menstrual irregularity, infertility, excessive hair growth, hirsutism seen in case of the PCOS. And some women we are noticing non-lactational breast secretions, milk secretion from the breast, along with that menstrual irregularities and infertility, decreased bone health seen when prolactin hormone is excess. And another important thing is that early fracture seen when there is a female sexual hormone deficiency is there, and there is imbalance in parathyroid hormones. And growth hormone deficiency may lead to the gigantism or short stature in women. And there is hair loss, which is a universal complaint in many endocrine diseases. So these are the symptoms which is experienced by these women in suffering from this endocrine disease.
Thank you, Dr. Jayashree Swain. So, a lot of women out over there, if you're suffering from hair loss, obesity, changes in mood swings, if you're noticing that in the women around you, then time to go and check whether hormonal imbalance is the cause for that or not. Now, here's an interesting fact. Did you know that most endocrine autoimmune diseases are more prevalent in women than in men? And let me ask Dr. Neeti Agrawal, why is that so, Dr. Saab?
So we need to understand that men and women are made differently. So they have different sex hormones. Women has 2 X chromosomes while men have 1 X and 1 Y. The genes which are related to immunity are actually present on the X chromosome. Now the second important fact we need to understand is the inactivation of certain genes or silencing of genes which happens during embryonic life in women, so that part of the genes, some of the genes are inactivated on one chromosome and some are inactivated on the other chromosome, X chromosome. And this happens randomly in different cells. So what happens is that the genes or the proteins which are produced by some of the cells are perceived as foreign by the other cells. That's one reason. The second important thing is that the immune regulatory genes are also present on the X chromosomes. And these immune regulatory genes are regulated by the female hormone estrogen. So there are phases during a woman's life when estrogen is high. For example, during pregnancy, when estrogen levels rise, the immune regulatory genes are suppressed. So we see that the immune mediated disorders are lesser. However, as these estrogen levels decline post delivery, these genes get activated and autoimmunity again resurges. So that is the basic reason as to why it is more common, and not just hormonal autoimmune disorders, but autoimmune disorders in general are more common in women because of this genetic difference.
Thank you, Dr. S. Sridhar. That was insightful. Dr. Agrawal, that was insightful. My next question, however, is for Dr. S. Sridhar. You see, woman endocrine disorders. What are some of the common woman endocrine disorders that one can identify?
So in the order of prevalence, the most common endocrine disorders in women is a hypothyroidism. That is a thyroid dysfunctions. So 2 types of thyroid dysfunctions. One is a hypo, that is a reduced productions of thyroxine hormone. Second one is a hyperthyroidism, that is a excess thyroid hormone. The most common is a hypothyroidism. The prevalence varies from around 10 to 15%. And they may be having symptoms like cycle disturbances, the neck swelling, and there may be a delay in fertility like that. And subsequently, the second most important thing in a woman's life is a polycystic ovarian syndrome, that is otherwise known as a PCOS or PCOD. It happens in around 20 to 30% of women's reproductive life. That is most common in 20 to 30%. So the most common symptoms again, obesity, there may be a neck hyperpigmentations, or maybe a cycles irregularity. And subsequently, the third most important issues are osteoporosis. It is more common seen in the post-menopausal individuals or the women of age group of 50 plus. So the osteoporosis due to the defective bone mineral density. So that is again most important, the hormonal problem. The fourth one may be a gestational diabetes mellitus, or there may be a diabetes mellitus that leading to issues in during pregnancy. That is another issues. And the fifth one may be the menopausal related, or the menopausal symptoms. There may be a heart pressures, or maybe a mood swings, or maybe a dyspareunia. In such an some of the things that can happen. Rarely, women may encounter in Sheehan syndromes, maybe due to the pituitary related issues. So there are various endocrine disorders that most commonly affecting the female populations. So we have to be more aware about all these entities, and we have to appropriately recognize, and we have to treat it.
I can't tell you how insightful this information is going to be for all our female viewers. Now, I know that Dr. Jayashree Swain, some time ago I asked you a question about what are the common symptoms that one can look for when it comes to identifying hormonal imbalance in women. But I have another question that most women would want to ask. And let me be a representative for them and ask you this one. So, Dr. Swain, obesity is a common health problem that we come across largely in women, often causing all kinds of depression, all kinds of other challenges. And of course, weight gain and weight loss stories in women are far more challenging when it comes to men. Can a female hormonal imbalance be the cause for weight gain?
As per the WHO data, more than 1.9 billion of the adults, they are suffering from the overweight or obese. Out of that, 40% are these female. So definitely a hormonal imbalance in female lead to the obesity, and the excess deficiency of the thyroid hormone, which is known as hypothyroidism, that is one of the important cause of the obesity. And again, excess of the cortisol hormone, glucocorticoid, lead to the Cushing syndromes. Particularly here we notice this is central obesity or depositions of this fat in the abdomen. And again, insulin resistance, imbalance in the testosterone, dihydroxyandrosterone or androstenedione, or lead to the obesity, polycystic ovarian disease. Again, type 2 diabetes, insulin resistance is another important cause. And that metabolic syndromes, that things we have discussed nowadays frequently. It is the cluster of the disease of hypertension, pre-diabetes, and along with that dyslipidemia is another important cause of the obesity. And apart from that, some rare causes like hypothalamic disorder, in which that is satiety center of our brain is stimulated, that lead to excess hunger and overeating, leading to the obesity. And imbalance of this hormone, which is responsible for this appetite, namely ghrelin, leptin, neuropeptide Y, lead to this obesity. So these are these hormones which are responsible for obesity. Imbalance of this hormone lead to the obesity in women particularly.
So there it is. You've heard it from Dr. Swain on NDTV itself, that if you are one of those who are suffering from obesity, then the causes could be many, from PCOS to thyroid, hormone, and of course other causes that Dr. Jayashree explained to us. Dr. Neeti Agrawal, my next question is to you. There are a lot of young women out there, just recently married, wanting to have children, but I want to understand from their perspective, what is the role of hormones in cases of infertility in women?
So we need to understand that normal egg release is governed by an axis. So there has to be a sequential timed release of the hormones in order that the egg is released for fertilization. So the hypothalamus, which releases the GnRH hormone, will stimulate the pituitary to release the FSH and the LH in a timed and in a sequential manner, which will stimulate the ovary to secrete estrogen and progesterone, the surge which will lead to the release of the egg and preparation of the endometrium for implantation. So if there is an abnormality in the axis anywhere, not just in the release of the hormones or the timing of the hormone even, it can release to infertility. So this is important that these hormones are released in sequence and on time, so that the ovum can be released and the fertilized egg can then be implanted to result in ultimate pregnancy. Besides these, other hormones like the prolactin which is secreted by the pituitary, can also, when in excess, lead to infertility. And of course, the thyroid hormones, whether in excess or if it is less, that can also lead to infertility. So whenever we are looking at infertility, we need to have a hormonal evaluation for certain.
Dr. Adrenal, that is absolutely wonderful. Thank you for explaining that to our viewers, and I'm sure they will all benefit from that. We're going to take a short break and then come back and talk about what causes could lead to menstrual issues when it comes to hormonal imbalance. That right after this break. Welcome back to our show, Health and Wellness, Myths and Facts. We're talking about hormonal imbalance and typically how that affects women in particular. My next question to our esteemed panel, and from there I'm going to talk to Dr. S. Sridhar this time, and I promise everybody that we're going to come back and talk about menstrual issues. There are very many young girls out over there who get their first period either early, and some of them even get it later than the others. I'm talking typically about the teenage age group. What are the reasons for this, Dr. Sridhar, and when should parents worry and consult their doctors for the same?
So during the teenage, that is menstruations or starting of menstruation, otherwise known as a menarche. Normally in India, in current situations, the age of menarche is around 11 to 12 years. Previously it was 13 or 14 years. There may be various reasons that behind that the onset of menstruations. One of the most important reasons is genetic. That is the mother's menstruations or the father, sisters or siblings menstruations. So the genetic reasons is one of the major important determining factor, and subsequently there is a nutritional. If the child is obese, the girl is obese, there is going to start a little bit early menarche. So the obesity is one of the other main important reasons for the onset of menstruations. And the third one is the hormonal imbalance. If it is hypothyroidism, there may be a relative deficiency of the onset of menstruations, or maybe other hormonal disorders, that is a pituitary disorders like hypogonadism, hypogonadotrophic hypogonadisms, or from the brain that hormones that secretes is less, that leading to the delay in the menstruations. So there is a coming all together. So one is a genetic, second is a nutritional, third one is a various hormonal disorders. And coming to when the parents should seek medical attention. So as I already told that 11 to 12 years is the current situation is going in India. So one may wait up to 14 years. So if there is no menstruations at 14 years, or there is no progression in the breast development, or there is a pubic hair, that is a private parts, there is no pubic hair development. So these are the various factors. In rarely, the menstruations may start at early, maybe below 9 years. So in such situations also, one should seek medical attention. So anything less than 9 years or anything beyond 14 years. So if anything, nothing is happening beyond 14 years, definitely they should seek either physicians or gynecologists or endocrinologist interventions.
Dr. Jayashree Swain, while we just asked Dr. Sridhar about common menstruation issues that could be in young girls and teens particularly, I want to ask my next question about slightly older women. Some women suffer from prolonged bleeding or have an extremely heavy period. What are the common causes of such abnormal uterine bleeding?
Prolonged bleeding or abnormal or heavy bleeding, we can designate it as abnormal menstrual bleedings, and it is defined as when the blood loss is more than 80 ml and when the duration is more than 7 days, and when the cycle intervals is less than 21 days. So it is defined as abnormal menstrual bleedings. The cause may be this medical cause, surgical cause, or hormonal local cause, or maybe these hormonal disturbances. Among these hormonal causes, thyroid disorder, obesity, insulin resistant, PCOS, prolactin and cortisol hormone disorder may lead to these abnormal uterine bleedings. If we look to these medical cause like bleeding disorders, hemoglobinopathies like sickle cell disease, thalassemia and von Willebrand disease are important cause of these bleeding disorders. And coming to these drugs, what are the drugs responsible for the bleeding disorder? Commonly we are using the anticoagulants, and it may be the cause of the abnormal uterine bleedings. And coming to the local cause, there may be the uterine fibroid, cervical polyp, uterine carcinoma and cervical carcinoma. These are the important cause of these bleedings. And apart from that, intrauterine contraceptive devices induced abnormal bleeding we are coming to our notice. These are the important cause of these bleeding disorders, abnormal uterine bleeding or abnormal menstrual bleedings in women.
Thank you for that. And I'm sure a lot of women watching this would know that if they are suffering from such kind of bleeding, it's extremely important, therefore, to consult a doctor immediately. Could be any of the causes that Dr. Jayashree Swain was talking about. My next question is to Dr. Neeti Agrawal. What is the difference between chronic and acute abnormal uterine bleeding?
Okay, so as the name suggests, acute uterine bleeding means uterine bleeding which is abnormal and requires immediate attention. The bleeding has to be stopped immediately to prevent further loss. Now, chronic uterine bleeding is the uterine bleeding which is happening over a period, which is abnormal and happening over a period of more than 6 months. The acute uterine bleeding can happen in isolation, or it can happen superimposed upon a background of chronic uterine bleeding. So the causes of both acute and chronic uterine bleeding are actually the same, as Dr. Jayashree has just told. All the causes can be cause of either acute or chronic uterine bleeding. But acute uterine bleeding needs immediate attention and can result in severe anemia, hemodynamic instability. So sometimes acute uterine bleeding may actually need blood transfusion. Sometimes it may need tampon adding so as to stop it immediately, while chronic needs a evaluation. Of course, both have to be evaluated for the causes and thus management.
That's insightful, Dr. Neeti Agrawal, which is what brings me to my next question to Dr. S. Sridhar. How long does abnormal bleeding last? How can a woman judge if the bleeding is too much?
So normally the bleeding lasts for 3 to 5 days in each cycle. So if any bleeding lasts 5 days or more than a week, that is definitely abnormal. Or if bleeding is happening once in less than 21 days, that is again it is abnormal. And if bleeding is very heavy, what way we can indirectly know is the passage of clots. So the passage of clots is one of the abnormal sign. And another one is a changing pad. So normally the frequency of pad change, if the particular individual is changing the pad less than 2 hours, within the less than 2 hours if changing the pad, they are accused to change the pad within less than 2 hours, it's definitely abnormal. So if it more than 7 days and changing pads of less than 2 hours and the passage of clots, so these are all very dangerous signs, and definitely they should visit the physicians or gynecologists.
So all the female viewers of ours watching right now, if you're going through this, it's extremely important that you reach out to your gynecologist at the very instant, because this could be a little dangerous. What treatment options are used to help control abnormal bleeding? My question is to Dr. Swain.
Yeah. Treatment of abnormal uterine bleedings always depends on the cause. Then the treatment may be supportive treatment, medical treatment or hormonal treatment or surgical treatments. Among the supportive treatments, you may go for the blood transfusion if there is severe anemia, and again antifibrinolytic treatment if like tranexamic acids are used frequently. And among the hormonal causes, if there is thyroid disorder, if there is polycystic ovarian disease, and if there is a cortisol disorder, so you may treat that patients. And weight loss in case of the polycystic ovarian disease, thyroid illness, and along with that type 2 diabetes, obesity is very much helpful for control of these bleedings. Sometimes we need hormones like that of estrogen and progesterone, or progesterone alone in heavy dose to control our bleeding. This is used frequently. And some of the cases we need gonadotropin releasing hormone analog or GnRH analog for treatment of these abnormal uterine bleedings. And again, surgical if there is uterine fibroid, uterine polyp, uterine cancer, or cervical cancer, cervical polyp, surgery is the definite treatments. So treatment is always according to the cause of these bleedings.
Thank you, Dr. Swain. My last question is to Dr. Neeti Agarwal. When should a woman worry about abnormal uterine bleeding?
So whenever a woman feels that it is abnormal uterine bleeding, so something which is not usual for the woman, she should seek medical attention. However, as Dr. Sridhar said, that if the bleeding is too much, so requiring to change pads frequently, as often as every 2 hours, or if it is lasting for more than 7 days, or the patient is flooding very often, the pad is flooding, it is not contained, or if there is anemia because of chronic blood loss, or then the patient should seek medical attention. So,
all right. So, Dr. Neeti Agarwal, I'm sure that a lot of our viewers today have benefited, parents, teens, and of course women, every one of those. I'd like to thank our esteemed panel today, Dr. Sridhar, Dr. Neeti Agarwal, and Dr. Jayashree Swain. Thank you so much for being with us today. We will see you very soon next time in another episode of Health and Wellness Myths and Facts. Thank you so much.